I'm Barbara Schouten, and I am indeed leading the Mental Health for All project, which is an EU-funded project that aims to promote access to mental health care services for refugees and other migrants that come into Europe and that don't speak the dominant country of the host country that they reside in. There's a huge problem with professional interpreting services. There's no regulation, directives whatsoever at the EU level that secures these patients' right to professional interpreting. The implication of this is that many treatment sessions are being done by untrained interpreters to bridge this language barrier. We are facing millions of refugees and other migrants that do not speak the language adequately to communicate with a mental health care provider, but are in need of mental health care treatment. So there are a lot of problems that needs to be tackled, and that's where the mHealth for All project comes in. And we try with this project to promote access for these groups of people to mental health care services by developing and evaluating a multilingual communication platform focusing on these different dimensions of access. So availability, approachability, acceptability and appropriateness. So we're trying not only to increase the literal access to mental health care, but also to make mental health care more culturally sensitive. The content of both these patient information and mental health care provider trainings will be based on research that we are doing right now. We have done a rapid literature review, a survey among different types of mental health care providers, and an interview study among patients and among interpreters. One of the things that we found was that there are main barriers that are shared by all stakeholder groups. They indicated there's a lack of good interpreting services, a lack of culturally validated screening tools. We also asked them which communication strategies they currently use to bridge the language barrier. What they actually want is professional interpreters on site. They think, okay, we need professional interpreters. And when asked about the facilitators of access, you see kind of a mirroring of these results. So what they want is access to good professional interpreting services, good informational materials, and training for mental health care providers. So our next steps, based on all these results, is to develop further the content of our platform.